Let's look at the three big outbreaks in descending order of their size. So New South Wales to begin with, which has reported another 1,284 cases today. Look how remarkably consistent the last 6 days in New South Wales have been. The 7-day average, because of how these numbers have really come off the peaks we saw last week, is continuing to come down, about 1,300 cases a day, still concentrated to the most affected LGAs, particularly Cumberland, Canterbury, Bankstown, seeing the most improvement, and cases still rising in some parts of Sydney. So it's beyond really doubt that we've seen a peak in the New South Wales curve. The question, I think, will be, is this a kind of peak that's going to see us come right the way back down, much closer towards zero before the state starts to open up again? So that's question number one, and I think part of that really, hinges on, are we going to see improvement outside the LGAs of concern as well, which look like they're taking a little bit longer to turn around. The second then question being, how much better can these numbers get in the next 3 weeks or so before the 70% double dose milestone is reached, which will, according to the New South Wales government plan, trigger a series of restrictions easing and a series more freedoms, which presumably will slow the rate of descent. At the very least, will it maybe even see an increase in cases? Well, that's the unknown at the moment. How much is this going to increase transmission, this first step of restrictions easing, and how low can we get these numbers in the meantime, so that the state can handle what is to come, which, as we say, is a little bit unknowable. The number of people in hospital in New South Wales, it's actually, it's kind of flattened out in the last few days or so. 1,245 people in hospital at the moment, 228 in intensive care, 112 on ventilators. What we might be seeing here is the increasing impact of vaccinations and vaccination coverage, just reducing the severity of people's illnesses. And if that's the case, that's a really good thing to see. We'll just keep monitoring these numbers to see if that trend continues. But certainly it does look like the share of people going into hospital at the moment has been dropping as that vaccination coverage increases. Sadly, though, we are seeing more deaths in New South Wales, 222 in total through this outbreak, another 12 today. So the third day in a row with 12 deaths recorded, including some quite young people today who have died, including one who was in a disability care group home. So the number of deaths is continuing to trend up, unfortunately. The good thing is, with cases starting to fall, hopefully we'll see an improvement in these numbers in the coming weeks as well. And hopefully, we'll start to get a clearer idea of exactly how much pressure the hospital system will be under next month, as we start to see kind of how big and how real this peak that we're seeing is. In Victoria, we've got another 510 cases, about the same number as yesterday. This trend line is still tracking upwards, maybe starting to slow down just on the speed it was growing a few days ago, and it was growing very quickly. So maybe some slow, the beginning of a descending in this kind of speed of growth, which would be good to see as, again, vaccination coverage improves in Victoria. Double dose rates are above 40% of the 16 plus population. So hopefully that is starting to have an impact. Hospitalisations in Victoria are growing relatively quickly at the moment. 208 people in hospital, 49 of those in intensive care, 32 on ventilators. So still pressure growing on the health system there, and it's a health system that we know is under a bit of pressure with, healthcare workers that are frankly exhausted after dealing with this pandemic for so long. A big backlog of surgeries and things from last year that are happening this year. The pressure is real in the Victorian health system, so hopefully we don't see these numbers continue to grow too rapidly. And then finally, the ACT, 30 more cases today. So this is an escalation on what we've seen in the last week or so. Hard to know if it's a one-off spike like we have seen before, 30 and 32 there, or if it's the beginning of something worse. The number of cases with exposure in the community is up today. Andrew Barr, the Chief Minister, did express some concern, but it's just going to take a few days for us to know if this is a blip, if it's a one-off, if we're going to return to this kind of really stable situation. But certainly the number of cases infectious in the community, it's kind of creeping up again to the, peaked about here, and it looks like it might be creeping up to that level again at the moment. So one to watch, just to see if this outbreak, which has been remarkably stubborn and consistent and stable, if it's now, the luck has run out and it might be starting to increase again. Time will tell. We'll give it a few days.